Hi, everybody. Welcome to our sixth webinar in our series of Friday afternoon webinars. My name is Leah Hellerstein. I'm the program director at Myotonic, and I'm very excited today to introduce our ADL's webinar. I will get started with that in a little bit. I just wanted to give a few updates from the foundation and just make sure you're aware of some of the resources and events that we have coming up. So just to remind you all, we are the Myotonic Dystrophy Foundation, also known as Myotonic, founded in 2007 by families looking for support, resources, and a cure. Our mission is care and a cure, which is to enhance the quality of life of people living with myotonic dystrophy and accelerate research towards finding treatments and a cure. Our work focuses on support, education, research, and advocacy. So just to remind you about some of the resources we have available, we have our toolkits here listed on the screen on our toolkits and publications page. We also have our virtual support groups and Facebook chats, which you can find more information about on our Find Support page. And our calendar of activities lists all of our upcoming groups and programs. And our Digital Academy has information from past conferences and events, and you can find that at the Digital Academy link listed on the screen. We wanted to remind you about some of the new resources that we've recently published, one of which is the Employment Access Toolkit, our guide to navigating the employment process for people living with myotonic dystrophy. This is a great guide to help people at all stages of employment, how to look for work, how to write cover letters, resumes, tips for viewing, and much more. You can find that at our Toolkits and Publications page, and you can also request a hard copy, which we would be happy to mail to you. Our other resource that we've recently published is our Health Insurance Considerations Guide. This is a resource guide that will help you navigate the process of getting medical insurance, treatments, medications, coverage, and all that's included in insurance. And so please take a look at that on our website for a download. We also have our DM Family Registry. For you, those of you who are not a part of that, we'd encourage you to consider joining. The link is on the screen, and this is a very important effort in order for researchers and families to learn more about the prevalence of myotonic dystrophy and how to get more involved in research. So anyone who's registered will have access to that data, including individuals and families. So please consider joining if you haven't already. So just a quick plug for our Friday afternoon webinar series. We have a variety of webinars still coming up for the next few weeks. We have gene editing coming up next Friday, the 29th. We have our exercise for the community coming up on June 5th. And on June 12th, we have a presentation about DM2, systemic and cognitive aspects. And on the 19th of June, our last webinar, will have a great panel of researchers and clinicians talk about the myotonic dystrophy in the brain, causes, effects, and treatments. So our past webinars are also listed on our website. We are recording all webinars, and we have information listed on the website about all of them. You can listen to any of them at any time. And so we encourage you to check out some of the past webinars if you haven't had a chance to listen in. We will send out a recording. There was a question in the chat box today. We will send out a recording of this webinar as well as all future webinars. So take a look at your email this afternoon for that information. So a quick plug for next Friday, May 29th, Gene Editing for Myotonic Dystrophy. This is a very anticipated webinar, will be presented by Dr. Vincent Dion. It's about gene editing, and the description here on the screen. Dr. Dion will discuss the progress that has been made in the field, limitations and challenges, and kind of everything that comes with gene editing. So we hope you can join for that. And also, if you aren't aware, we are piloting a fun project to try to increase our awareness of our community members and just honor gratitude in general. So as you can see on the screen, we've created the My Gratitude project. So we encourage you to post a picture with My Gratitude hashtag or send us a photo at development@myotonic.org. You can see that some of our staff and community members have already submitted photos. So we really encourage you to take a look and consider joining this effort. And then a new resource we hope you will join for, is Monday, June 1st, about a week and a half from now, we are starting a free virtual chair yoga session. And so this session is hosted by Ellen Shapiro. She is a community member who has a lot of experience working with people with DM, and she has family members who have DM as well. So you can see the information on the screen. And we hope you can join. You can join by Zoom and or by phone. So please consider joining. And last but not least, we wanted to make one last plug for our food preparation contest. We've had this contest going on for about the last 3 to 4 weeks or so. And this is a contest in which you can create a 5-minute or less video to talk about a dysphagia-friendly meal. So the instructions are on the page, and they are also listed at the myotonic.org/food-preparation website. So you can see on the screen where you can find that information. And our deadline to submit video entries is next Tuesday, May 26th. So I really hope you can submit an entry. There will be prizes. And we've already received a few great videos so far. So we're very excited about that. So on to today's webinar. Today's webinar, Beyond Activities of Daily Living, Strategies for Life Modification, Socializing, and More During COVID-19. Very excited to present Dr. Cynthia Gagnon and Samar Muslemani, our speakers today. So just a quick introduction to Dr. Gagnon. She is one of our most anticipated speakers at our conference. We always have fabulous feedback about Dr. Gagnon, crowd favorite for sure. She's a researcher and clinician at the Université de Sherbrooke in Canada. She's trained as an occupational therapist and obtained her PhD in rehabilitation in Canada. She is one of the leading researchers on neuromuscular disorders in Canada, including myotonic dystrophy. She's developed and validated several outcome measures among these populations in preparation for clinical trials. She also leads various international efforts and has worked on clinical guidelines in the rehab field and in rare diseases. So we're very lucky to have her here today. And I would also very excited to introduce Samar Muslemani, occupational therapist. She's a student at the same university in Canada, working with Dr. Gagnon. She is pursuing a master's degree in independent living and researching patients with childhood onset DM, and has finished data collection in both Quebec and France. And she is here, she's very passionate about supporting the practice of getting more professionals involved in the care of DM1 patients. So I am just going to quickly turn over the wand just to Samar. So 1 second, please.
Hello, everyone. I hope you're hearing me well. Me and Cynthia, we are both really happy and excited to be there with you today to talk to you about strategies for life modification, socializing, and more during this challenging times in COVID-19. The goal of our presentation, we're going to talk to you about, of course, what is occupational therapy, because some of you might not know what it is. We're going to give you general recommendations for you as DM1 patients for COVID-19. And then we're going to talk to you about occupational therapy strategies to help you with your activities and your social participation during COVID-19. So what is occupational therapy? So we are healthcare providers, and our goal is to help you. We collaborate with our patients to help them find solutions so that they can do their activities. We aim to enable people to participate in their occupations or activities that give meaning and purpose to their lives. So we work with different clienteles. We work with children, teenager, adults, and we work in different places. Like we can come to your home, we can work in hospitals, in rehabilitation center, and we work as much as we can work with people who have physical disabilities, mental disabilities, intellectual too. So we can help, or anyone who doesn't have, if someone doesn't have a diagnosis, we can still help them. If you have a problem with an activity, we're here to help you find a solution. And we work in different areas, activities of daily living, so ADLs. We can work in activities like eating, cooking, so things we do every day, but also more complex activities like driving, going to work, leisure, sexuality. So we can work in a big range of activities. And specifically for DM1 patients, as you might already know, clinical presentation varies a lot. Someone might have only a very few symptoms and be in their 60s, whereas you might know very young children severely affected by the disease, or simply an adult who falls more than once a week. So even though it's all the same disease, it's not the same management. So this is important to take into account. And also, we occupational therapists, we like to consider three main factors when we work with someone. It's, of course, the person, the occupations or activity, and lastly, environment, because your environment has a huge impact on your activities and your social roles. For example, we consider we take into account if you have access to services, if you have support or not from your family and friends, if you have access to technology, if you have home adaptation, for example, if you have stairs or an elevator to your apartment, and of course, your financial means, which are important because of, for example, buying technical aids or equipment. So we take all of these into account whenever we work with you. And now I'm going to give you a general recommendation in the COVID-19 context. So this is not this is general, so not the occupational therapy part. We'll go back to that later. But because me and Cynthia, we work with the NMD4C, which is the Neuromuscular Disease Network in Canada. And we have made, not me, but my team has made great guidelines for people who have neuromuscular disease in the COVID-19 context. And I'm going to present it to you because I think it's important. So first of all, what is COVID-19? COVID-19 is an illness caused by a coronavirus. The symptoms, the most common symptoms are, of course, cough, difficulty breathing, but you might also have fevers, chills, muscle pain, headache, sore throat, and new loss of taste and smell. And as you know, we're only beginning to discover this new disease, and every day we're learning about new symptoms. For example, new loss of smell and taste. We didn't know that at the beginning, but now we know. So it's important, if you can, to keep watching the news about it to learn about the disease. And also, we also have learned that some people might have the disease and be what we call asymptomatic, which means that they don't even have symptoms, but they can still transmit the disease. So just so you know. And the symptoms may take up to 14 days to appear after exposure. So that means whenever, if I get in contact with someone who gives me COVID-19, my symptoms may begin tomorrow, but they also could begin in 14 days, which is why whenever you've been in contact or you might be more at risk, you have to isolate yourself for 14 days. This is what we call the period of incubation. And last, you have to know that COVID-19 can be spread by respiratory droplets, close personal contact, or touching something with the virus.
Care and a cure, which is to enhance the quality.
Your nose or your mouth. Take a sip of water. So now to the recommendations. As everyone, you have to keep social distancing. Even though I don't really like this word, I prefer saying physical distancing because you can still keep in touch and it's important with your family and friends, but you know, physically distant. So physical distancing, hand washing often, disinfecting surfaces like everyone's doing, I hope. And also because you are a neuromuscular, if you have a neuromuscular disease, we suggest that you make sure you have a 3-month worth supply of your medication if possible, and that you also carry with you an alert card on hand to communicate your medical needs and symptoms in case of an emergency. I think Leah told me before that the Myotonic Dystrophy Foundation have given you access to some alert cards and also bracelets, which is really useful. For example, if something happens to you and you cannot tell the healthcare providers that you absolutely have to tell them that you have a neuromuscular disease because it can put you at risk. So these cards or these bracelets can help you with that. So these times it's particularly important that you take them with you if you go out. And also with the NMD4C, we made the poster. And I thought it was really great, so I want to show it to you, but it was too big. So I've divided it in 3. And so I'm going to present it to you. What should I do during COVID-19 crisis if I have a neuromuscular disease? So first, can you get COVID-19? Of course, we can all get COVID-19. However, you may have more complications than the healthy population if you have heart, breathing, or swallowing problems, which, as we know, DM patients do, or if you're on immunosuppressants or steroids. Also, the other part of the poster is a few ways to prevent getting COVID-19 or giving it to others, as I've already talked to you about, and what to do if you feel sick. So if you notice any of these symptoms that I presented to you before, or blue lips or face or confusion, you have to call your public health authority and notify your healthcare provider. And you're gonna have to follow the instructions that they give you. If they recommend you to go to a hospital, for example, you have to take your respiratory equipment with you if possible. And you absolutely have to inform them that you have a neuromuscular disease and if you are taking immunosuppressants and steroids. Also, if you have help from a caregiver, for example, for bathing or for cleaning your house, you have to know that caregivers must be extra diligent these times, because first, if they would give you the disease, you are more at risk, and also because they might be visiting multiple homes each day. So they have to be cautious because they could give it to a lot of people if they were to contract COVID-19. So we recommend that caregivers should always wear a face mask when in contact with neuromuscular patients, whether they feel sick or not, because as I said before, there's people who are asymptomatic, which means they don't have symptoms, but they can still transmit it. So we recommend that caregivers always wear a face mask. Also, caregivers, they should stop working or caregiving immediately if they feel sick. And also, if you can, I suggest that you identify a backup caregiver in case your primary one becomes sick or cannot give you your care. And if you do identify this backup caregiver, make sure that you have a paper or you give them information about your doctors, contact your doctor, pharmacy, and clinic, and a list of your medication and doses just in case, so they can help you and care for you in the right way. And so this was only a few slides, but the team has made a more detailed document that you can access on their website. If you have a cell phone right now, you can try my QR code, but it doesn't always work. But you take your phone, you put on the camera, and then you make it as if you wanted to take a picture, and the link should appear. But also you can type NMD4C on Google and it should pop up. Okay, so now I'm gonna explain to you why DM patients might be more at risk during COVID-19. And I'm gonna give you occupational therapy recommendation regarding these risks and how to help you do your activities during these times. So as you know, that DM is a multisystemic disease, which means it's not only your muscles that are involved, but also all of these systems that you see on your screen. And I've identified 3 systems that are the reason why you might be more at risk or might be more affected by COVID-19. First, the gastrointestinal tract, so your digestive system, your respiratory system, obviously, and a cognitive system or a nervous central system. And we're going to go through each one by one, and I'm going to explain it to you in more detail. First, gastrointestinal system. It's about eating. As you know, DM patients might have what we call dysphagia, which is a difficulty eating specific texture or food, or difficulty swallowing. So we estimate that about 20 to 80% of DM patients might have dysphagia because of the weakening of your throat muscles. And as you know, and why is it linked to COVID-19? It's because dysphagia can lead to aspiration, which is when you eat something and it doesn't go to the right track to your stomach. Instead, it goes through your airway and to your lungs, and then it can cause infection, and this is what we call pneumonia. So this is why dysphagia puts you more at risk because of COVID-19, as it affects the respiratory system. So I'm going to give you a few alert signs that you might need to call to contact an occupational therapist. If you notice that you cough often during meals, if you have stopped eating certain foods like popcorn, chips, crackers, which are harder to eat, to chew, then I suggest that you contact your occupational therapist, because you might have dysphagia and you are more at risk. And what can occupational therapists do for me? We work in team with a nutritionist and speech therapist in our interventions, and we can help with texture adaptation, so that the food is easier to swallow. We can help teach your family the Heimlich technique in case you choke with some food. And of course, positioning while eating. Here it is. We recommend, so that you have less risk of swallowing wrong or choking, we suggest that you have a good posture whenever you eat. You have to sit upright during all the meal, and also after, for about 20 to 30 minutes. If you sit right and not go lying, for example, that's not good. It will help the food go down the right way. Also, whenever you swallow something, we recommend that I'm going to show it to you. I like example. So I'm going to take a sip of my drink. I'm going to chew normally, but not the drink, but if I had taken a bite, I would chew normally like that. But when it's time to swallow, I recommend that you tilt your head so that the chin points to the chest, for example. So I swallowed, you didn't see, but I swallowed when my chin was pointed like that. So it makes like more space for the food to pass through your GI tract. Also, other general recommendation for when you're eating, take your time, take not breaks, but take one bite and then take your time to swallow it good, and then take the other bite. And also, don't take big bites like the guy eating spaghetti. That is not good. If you can take smaller bites, it will not only lengthen the meal, will take more time, so it's good, but also it would be easier to chew and to swallow. Now, second, respiratory system. We talked about it a little, so I'm gonna go quick on this one, but you have to know that pneumonia is the most frequent cause of death among DM1 patients. So it's really important that you do what you can to prevent yourself from having this kind of problem. What you can do is get your vaccine updated. If you can get a dysphagia assessment, as I said before, if you have alert signs, that means that you should go consult someone. If you can stop smoking, of course, and being extra cautious during this pandemic. About smoking, I thought it was kind of important these times. So I wanted you to know that there's 30% smoke. The 30% of patients that are smokers, even though respiratory problems are the leading cause of death. So don't hesitate. If you're considering stopping smoking, don't hesitate to contact your doctor. Because he can help you find solutions to stop smoking. And the benefits come quickly. So it's never too late to stop smoking. And also, I was curious about, and I'm probably not the only one, but I was curious about smokers and tobacco users, if they were at higher risk for COVID-19 infection. So I went and looked it up for you, and there's two kinds of risks. First, there's a higher risk of catching COVID-19, because the act of smoking means, I'm going to take my pen, but the act of smoking means that fingers and possibly contaminated cigarette, you have to take your cigarette and you put it directly on your mouth. So if you have a contaminated cigarette, or if you touch something with the virus on it and then go smoking without washing your hands, then there's a higher chance that you give yourself the disease. So that's the first risk. And then there's also a second risk. If you contract COVID-19, smokers might also already have a lung disease or a reduced lung capacity, which would greatly increase the risk of serious illness. So that's the information I wanted to talk to you about. And third, but not least, central nervous system implication. There's a lot, as you know, there might be cognitive impairment with myotonic dystrophy. And today I'm only going to talk to you about fatigue and apathy, but it doesn't mean that the others aren't important. Depression and anxiety can be present. It should be assessed, especially in these times when we're all like having a hard time getting through this, and it's hard for our mental health. So it's still important. But today I'm going to talk to you about first apathy. Apathy is characterized by a lack of motivation, difficulty to take the initiative, lack of interest in daily activities. Lots of my patients describe it to me as a mountain. They know they have to do that task, that activity, for example, dishes, but it's like a mountain. It takes so much effort and it looks so hard, but it looks like a mountain to do, even if it's a simple task. So that is apathy. And it's different from fatigue, but it's different from fatigue, but both can make it harder for you to do your activities and to participate in your social roles. And the fatigue that you might experience is not the same as whenever people around you who don't have DM1 tell you that they are tired. It's not the same. And fatigue can really impair your ability to do your activities. So it's important that you get formally assessed by your medical team because your doctor might be able to prescribe you medication that might help. You have to eat well. It's important for your energy. And also your occupational therapist, but also there's also online courses available, but we can help you with what we call an energy conservation techniques. For example, dividing your task in two. If you have to prepare your meal, then the day before, cut your vegetables, and then the morning after you can continue. So it gives you a break and it's harder. Or you can just straight up buy already cut vegetable, which makes it really easier. You can you have to adapt your activities, be inventive, and occupational therapists can help you with that. And you might be asking yourself, why am I talking about fatigue and apathy right now and with COVID-19? It's because you might have noticed that fatigue and apathy is maybe even worse these days. And I'm here to tell you that you're not crazy if it's the case. It's really possible. And I'm going to take the time to explain to you why. These days we are experiencing what we call occupation disruption, which because we cannot do our usual activities anymore. We're not going to work, meeting with friends, shopping, for example. So our routines have changed, and it requires a lot of energy to find new solutions to adapt to those changes. And there might be a few people that adapt well, a few others that don't, and it's normal. We're not the same. I'm going to explain to you now why is it more complicated, harder for you. It's because usually when we're not in the pandemic, we wake up every day knowing what is planned, we do the same activities, we have the same routine. So we're kind on autopilot. And this way, it doesn't take a lot of energy from your brain. Your brain already knows what's coming. So there's not a lot of planning left to do. But now we cannot do our usual activities anymore. We have to find new ways to pass the time. We have to plan other activities. We have to find time to find other solutions to pass the time because we have a lot of time for some of us. We have a lot of time on our hands. So these brain functions require a lot of energy. So this is why you might feel that it's harder for you, your fatigue is worse, or you're even more apathic. So what you can do about it? I have a few suggestions for you. You could, first one, really important, is create new routines, which will allow you to bring back your autopilot. You can, for example, wake up and then every day, if you're a reader, you can read every morning. You can plan your activities so that you already know what's coming, and then it's easier for your brain. Also, you can plan new objectives, new goals for every week. And I'm not saying for a month, because this is too long and motivation will be hard to maintain. But if you plan objectives and goals for every week, ask yourself, what is your priorities? What do you want to focus on? What is more important to you? This will help you keep you motivated. And also, if you can prepare the day before. I'm going to tell you an example about me. Sometimes I go running, and these days, because of the pandemic, everything's changed, and now I feel like going running takes a lot of planning, lots of steps, and I end up spending an hour on my phone, on social media, and I never go running. But if I, for example, prepare the day before, for example, I prepare my clothes and put it next to my door, I charge my phone the day before, then when it's time, for example, this afternoon to go running, all I have to do, there's less steps to do. So all I have to do is put on my clothes that are already ready and go. So it's easier. So that might be a tip that can help you. And I also suggest that you start with your most enjoyable activity, because this will make you more motivated. And after, you're already in action, so it's easier to continue with the tasks that are less interesting. So that's about it for the suggestions about apathy and fatigue. But I really wanted to take the time with you to talk to you about resilience, because I'm giving you lots of strategies and tips, and I'm not expecting that everyone applies them like tomorrow. I think everyone is living, it's tough times for everyone. But if you can see this experience, this pandemic, as something to learn from, something that you can bounce back from, find your strength, your weaknesses, and then prepare yourself if you ever have other challenges, this might be a way to get through it a lot better. So that's about it for my part. I'm ready to pass the screen to my colleague, Cynthia.
I'm going to be talking about other ADL that might be complicated during COVID-19, and some of the strategy that we found that could be helpful. Okay, so for meal preparation, some of you may have a caregiver that is helping you with meal preparation. And in this time of COVID, that may be harder, or some of the people were receiving meal that were done by other people. So we already discussed in previous conference that I give about the ability to prepare a meal. And it's very important as the disease progresses and as you're getting older. And in this time of pandemic, it's really important that you're able to get good nutrition, because that will bring your system in a better shape if you're to have COVID-19. What we found that could be helpful is to really rely, for example, on pre-cut vegetable, or even better, on great delivery solution. And I'm not doing any promotion for Cook It or Good Food, but it's just the two main provider that gives you services so that you can receive boxes of food with specific recipe that could help you to make it easier. The other thing that you can also, and you should be doing, is that several grocery stores can prepare your order. So you can go online, or you can go on the phone and tell your grocery store what you want, and they will prepare it, and they will either deliver it at your house, or they can also do parking delivery. So that will prevent you to go to the grocery store. And in case you have a caregiver or your husband or your children that can do it for you, it's also a good strategy, because in the grocery store, there's a lot of chances that the virus could be there, and it's harder to protect yourself. In terms of bathing, it's also important because some of you relies also on help, either to get in and out of the bath or to receive a bath. So it's important to keep safe. And if you have trouble to receive, because we have some of our neuromuscular patients that didn't have access to outside carer, to personal assistance. So it's really about not taking a risk and just do basic hygiene and not try to transfer in the bath if you're not able to do so usually, because then if you take a risk and that leads to a fracture or to something else, then it's not a good time to go to the hospital right now for other things than, emergency or COVID-19. One thing though that wasn't in the PowerPoint, but is very, very important, because we see that at least in Canada, if you do have symptoms of other type than COVID, it is very important to still consult your healthcare provider, because if you have, there's some people that have stroke symptoms and they didn't go to the hospital because they were afraid, but that is worse. So if you have other symptoms of disease or other symptom important, call your healthcare provider and make sure you get your appointment, because that may lead to other consequences than COVID-19. Sadly, we still have stroke and head trauma and things like this in that pandemic. The other thing that is very, very important is to prevent fall, even more than ever. So you're maybe more at home. So you want to make sure that you decrease your fall risk, and you make sure that you apply those recommendations. So electric plug, rug, stair. So because you don't want to get a fractures in this time. The other point is home management. So a lot of our patients experience home management difficulty from 70 to 26%. And this is due to lower extremity strength, fatigue, decrease from family and friends. And the thing is that in that time of COVID, you may not be able to access the help that you used to have, either from outside carer or your family. And so it's really important to do some cleaning, but maybe wait a little more for a more risky or more difficult task, so that you don't take any risk of hurting yourself or you don't get too fatigued. So Samar's brought back that we all experience, or several of us experience, more fatigue. So it's important to not push your limit and maybe more willing to let a little bit more dust, get into your house. I'm just going to go that just for, okay. So now the other thing we wanted to touch upon is some of you may be now working from home like we do, Samar and I. It's also important to get a good working environment at home as much as we can. And one of the things that is really important, and you can get a lot of fact sheet on the internet, is to really have a good eyesight from your computer, so that your computer is not too low or too high. And one thing that we all do, and I'm actually doing it at my house, is to put some books below my computer, so that I can raise my computer and that it's at a good height for my eyes. So that's important. It's also important to take regular break at every hour, so that you can exercise a little, walk a little, just get out of your static position, and even more at home, because a lot of us, like myself, don't have my usual chair that I have at work. I just have a simple chair. And so it's even more important so that you don't get back pain or bad posture. One thing we wanted to touch upon is that as in Canada, as in US, as I think everywhere, there's a lot of people that are experiencing financial problems due to loss of employment. And so this is very important. And this may be difficult for some of you to reorganize your budget, reorganize your finance, go to the bank and ask for, you know, a break in your loan or things like this. So you may need to have some external help. And in case it's very difficult, you should talk to your healthcare team or your social worker, and they may help you to identify resources to help you with reorganizing your budget and your expenses in this time of COVID. And don't be shy or don't be afraid of doing this, because a lot of people are doing it, and it's not so natural for people to go back to their bank or to reorganize their finance. So really try to find some resources so that they can help you, but make sure you use a trusted resources, because the other thing that we see a lot in those times, sadly, is that there's a lot of people on the internet that try to take advantage of you with fraud email, with you know, we're gonna help you with your finance, and then it costs a lot of money to do so, and then you don't get any services. So you really have to be extra careful in the choice of resources that you use, but you still may need to have some, and that can be a good idea, but you just need to have a trusted resources. Now, going out of COVID-19, it's really important to still, you know, try to do some outside activity while respecting your state's legislation. So it was hard to make a general recommendation because every state is different. Like in Canada, every province is different. And even from us, the outside of the metropolitan area is different from Montreal in Canada, but it still remains important to go outside, to go for a walk. If you have trouble because you have, you know, your usual leisure activity are cut out, like most of us, you can still contact your OT or your healthcare team to try to find other activity that you can do outside, and to also register to adapted transportation if that can help you as well to go outside while maintaining physical distanciations. And now social media has been a big, you know, thing in that COVID period. And there is pros and cons on using internet and social media. Of course, there's a lot of entertainment out there. It helps you to keep in touch with your family. You can have online learning and online shopping. But there's also cons, which is related, and we'll talk a little bit more about it, about misinformation, source of anxiety, and cyberbullying. So entertainment, it helps you to keep busy. You can have online games. Like right now, I'm playing Scrabble with my mothers on an online platform, so we can chat on the right side, and we can actually play Scrabble. So usually we play in person, but now we play online. There's also some cool application. I'm just talking about one because that's the only one I know, but I know there's several of them. But for you who have Netflix, you can also have Netflix party, which means that you watch the same movie together, and you can have a chat box on the right side, so you can chat while watching the movie or the video, whatever you're watching on Netflix. So there's a lot of those resources that can help you having, you know, keeping yourself entertained with other people. And just to see how much, you know, like Facebook, Netflix, and YouTube have increased their attendance or their average daily traffic since the pandemic. And TikTok as well, but that's, you know, more of my teenager type of entertainment. For communication, it's really important to stay in touch with family and friends. There's a lot of platforms out there, Facebook Messenger, Google Hangouts, Skype, and FaceTime. One thing about Messenger is that there's also a kids application, which is called Messenger Kids. And it's great because it's got some parental watch over, so that you make sure that not everyone enters in contact with your child. So only the friends of your child have access to their messenger. But my kids are using it, and I have to accept every new friends that want to get into contact with my kids. So it's you know, it's a safeguard. There's also online learning and teaching, and some is free, so it's really great. There's also online museum, online art gallery, so there's a lot of stuff out there so that you can, you know, entertain yourself. And this is some of the platform like Zoom and Microsofting and Hangout by Google. So there's a lot of platform that you can communicate with your family. Now, the misinformation is really important. That's the cons of those social media. Because it's easy and quick to access the information, and sometimes you receive information that make it appear credible. There is some, I would say, initiative from like Facebook and Twitter to to counteract those fake news, but it's hard to get them all out. And sometimes it's been shared by your friends and your family, so you think that it's a good source, but that doesn't make it a good source. So what you can do is, if it's an information about your health, so before trying anything, before considering making some choices, make sure you ask your doctor or any healthcare professional, your pharmacist, your doctor, your nurses. Check where the information comes from. Is that a reliable source? And exercise caution. So slow down and think, and make sure that you're, before making decisions, especially related to your health or to your finance, make sure that you take time to think through and make sure that this is a good source of information. Anxiety is also a problem, because not enough information, too much information is also bad. So here you see the paper toilet
and programs, and our
so people were making hours of lines and buying tons of paper toilet. And I mean, COVID didn't bring anything related to paper toilet. It's not the flu. It's not the, how do you call it? I can't remember what it is, but I mean, it's not something with the gastrointestinal symptoms, So you don't need that much paper toilet, but people were like just, piling on paper toilet. So it's really important that you get some news, but if you feel that it's bringing you more anxiety than being more confident, then it's maybe time to cut down a little bit on those social media informations, and really make sure that when you receive those informations, that you still think, okay, is that credible? Does that make sense? Because there's a lot of inappropriate content that circulates among those social media. Just a word about cyberbullying. I think that it's very important for our children, especially that there is a lot more internet traffic, internet interactions. So there is people that will try to make use of that. And so it's ultra important to talk about your kids and your young adults, and even yourself as adult, to make sure that if you are having cyberbullying, or that you have inappropriate content that's coming to your social media, that you make sure that you know how to react, and make sure that your children are safe using those devices. Now, so should we stop social media? No, because I think it was one way of getting in contact with our friends, to entertain ourselves, but certainly it's all about moderations. So it's really about making the good choices through those social media. So that's the end of our presentation. So I think we still have a little bit of time for questions. This is some other resources that we have in occupational therapy. I really hope that this
Digital Academy has information about
give you some tricks to better go through that pandemic, and don't hesitate to ask questions. And thank you.
Thank you so much, Cynthia and Samar. That was really great. Lots of great information. I wanted to pose a few questions to either of you from our audience. The first one is about equipment. So I know that some people's houses may not be fully equipped for the kind of amount of time they're spending there right now. Are there any sources of equipment that you suggest, any websites or places that people can look to get more help at home when it comes to equipment?
Oh, yeah, okay. So let's say you've got in this situation where you don't have your regular healthcare provider, or you have less hours than you used to. Well, there is some online technical aid supply system. We can provide some. Samar and I can look at some of them and make suggestions so that you can buy directly from a vendor that can deliver it to your house. So that may be a solutions of having those technical equipment that you need. But for some technical equipment, I will not recommend that you do it. Like for baiting, you really need to have the appropriate recommendation for an occupational therapist, because sometimes you think that, oh, this will help me, but it may be dangerous, or it may be not well set up in your bathroom, so it can put you more at risk. So for like kitchen supply, for leisure, for those kind of thing, I think that you can buy it directly and try to use it and make some, see if it works. But if it's in terms of the bathroom, I would say that that's very tricky. But then your occupational therapy can do online suggestions probably, or telehealth. So with your computer, you can show her your bathroom. She has your physical evaluation, so she probably could recommend some technical aids using your camera and something like that. So there is potential solution that doesn't have to bring you to the hospital or to the rehab centers.
Okay, great. And kind of continuing on that note, some people may have an occupational therapist, some people may not. But can you advise on if someone does have one in the community and they might be feeling scared to go back to see them to the clinic? Are there ways to connect virtually with occupational therapists, and what sort of suggestions could they help with managing kind of shelter in place and modifying the home?
Yeah. So I would talk for the situation in Quebec right now. We are authorized to do telehealth. So that means that the person at home just need you can call. Okay, so regular phone, or if you have a iPhone or a computer that you can walk through like a laptop, you can actually do telehealth with your occupational therapist. So she can contact you and she can talk to you, and then probably can look at your kitchen or your bathroom and give you some advice. So for those who are afraid of getting to the clinic, the other thing is that a lot of clinics now have made special, I mean, there is some non-virtual consultation, like Samar still goes at home, I think, but she has an extra precaution when she does that. So she still do home visit when it's highly necessary. And so we do have those recommendations. We do have those protection equipment. So you make sure that your OT, if they enter at your house, they have protective equipment. So they have gloves, they have masks, they have all the necessary things so that she doesn't put you at risk to get COVID-19. And then that's why, so the best thing I think is to call your healthcare provider. And even if you don't have an OT, if you say, if you call your regular healthcare provider and you say, I think I'm at risk, I'm not able to manage my food anymore, or it's really complex to be alone now because I don't have my healthcare provider, I'm sure that those people could refer you to your social worker or an OT or some kind of community resources that can help you to get access to food or medicine or bathing or a personal care solution. The other thing, like let's say for just dressing, well, in those days we all use our jogging pants and our t-shirts. So make sure you save some energy by getting easier clothes to put on, and you'll be totally in style. I mean, that's probably one of the first days that I have a dress in so many weeks, so it was just for the occasions, because usually I'm in t-shirt and in jeans. So
Okay, thank you so much. I didn't see any other questions come in through the chat box. If anybody else has questions, feel free to send them now. But I just wanted to thank our speakers so much for that great presentation and remind everybody that we will email out the recording this afternoon. And also wanted to remind you that we have some financial resources listed on our website, and we have them listed by state. So if you need help with getting any resources right now, whether it's anything on your, in your home, if you're not able to access equipment or just kind of basic needs, please take a look at our financial resources and hopefully we can access something for you. If you don't see your state listed there or you need more guidance, please feel free to email us info@myotonic.org and we can try to find some resources for you. So again, thanks again, Cynthia and Samar. Great to have you today, and hope you stay safe. And thanks to everybody on the call for calling in today. And I hope everyone stays healthy and safe. And talk to you soon.
Thank you.